Good afternoon, everyone. All right, good afternoon, everyone. Welcome to today's session of Malaysia Kini's Health Talk Show series called Health Matters, where we will delve into the fascinating world of joint replacement, specifically focusing on total knee and hip replacement. All right, now I know what you might be thinking. All right, surgery isn't exactly a fun topic, but stick with us because you are about to discover just how incredible medical advancements have become. All right, let's start with a fascinating fact. All right, the first successful total hip replacement was performed in the 1960s, and since then we have made incredible strides with modern knee replacements lasting up to 25 years. And imagine what you could do with that kind of renewed mobility, right? Whether it's traveling, dancing, or simply enjoying more active days. All right, to give you a full picture, we are really excited to have not only one but two expert speakers joining us today. All right, first we have Dato Dr. Badrul will take the stage to delve into knee replacement surgery, explaining how it can make those everyday steps pain-free and enjoyable once again. And later we will have Dr. G. Ruslan will guide us through the world of hip replacement surgery, sharing insights on how this procedure can help you regain a freedom of movement. So whether you are here to learn for yourself or support a loved one, you are in for an informative and inspiring session, everybody. All right, please share this live to your friends and family. All right, let's kick things off by welcoming our first speaker, Dato Dr. Badrul Shah Badaruddin, consultant orthopedic, arthroplasty and sports surgeon. Hello, doctor.
Hi, Thiviya.
Hi, doctor.
Thanks
How
for
are you?
good. Thanks for having me today.
It's a pleasure, doctor. Doctor, to start things off, right, could you please tell us a little bit about what you do and what drew you to specialize in knee replacement?
Wow, that's like 30 years.
Do you have a story of how you
Yeah.
started off?
Um, well, of course, every orthopedic surgeons, they have to go through a lot of trainings, to get where I am. It's probably 30 years now. Um, uh, of course, I would like when I was in undergraduates, I like to do to be a cardiologist, but not so much hands. So I think I delved into orthopedics because a lot of carpentry work, right? A lot of use of hands, and and of course, then why joint replacement surgery? I think is again I find among all the orthopedic surgeries I've done, including spine surgery, fracture surgery, hand surgery, I find that a joint replacement surgery is probably the most rewarding because, in fact, in Time magazine, saying that one of the two most successful surgery or surgery in the world this century is joint replacement surgery. It's very
Wow.
rewarding. Yeah,
All
that's how
right.
I go into this field.
All
Um,
right.
yeah.
Okay, doctor. My first question, right? What are the most common reasons patients actually require a total knee replacement?
Okay. Knee replacement. The knee is a very important weight-bearing joint, right? So in any weight-bearing joint, including the hip, the incidence of or the occurrence of wear and tear is high. And in fact, 1 in 5 people above 50 years old will
Mm-hmm.
have some kind of osteoarthritis.
Mm-hmm.
So joint replacement surgery are actually indicated for advanced osteoarthritis. So when do I really think the patient needs joint replacement surgery for the knee or total
Mm-hmm.
knee replacement surgery or maybe partial knee
Mm-hmm.
replacement surgery? Number one, Of course, from the X-rays, is a stage 4 osteoarthritis. But from the patient symptom, if the patient say, I need to take a lot more painkiller nowadays to go and do routine activities. So now you know that from this you can see if the X-ray is stage 4 or even stage 3. Stage 4 means the bone is on bone. Stage 3, well, there's a little bit of space in the joint, if you see from the X-ray. So together with this information, you are ready for joint replacement surgery. It doesn't matter how old you are. Yeah. So when you have more bad days than good days, you need more painkillers to do your normal activities.
Then
Your
it's
X-ray,
time.
yeah, your X-rays is already stage 3 or stage 4. You are ready for joint replacement surgery.
Right, right, right. It depends on the situations of the knee, correct?
And of course, you have exhausted other means of treatment, like, maybe physiotherapy, maybe uh, injections, supplements. So these are the conservative treatment uh, for knee replacement surgery, arthritis.
All right, doctor. But in terms of technology, right, doctor, how has the technology for knee replacement surgery has evolved in the recent years? And how does this actually benefit patients in the long run?
Yeah, it's one of the reason why joint replacement surgery is nice, is good to take, for those who are aspiring to be joint replacement surgeons, for the doctors. Because joint technology also evolve as we go on, especially in AI, right? Um, the function, the aim of joint total knee replacement surgery is to get good function and to last very long. That means if it can last 15 years, 20 years, 30 years, that means, it's very good. It's a success story. So to achieve this, when I started to do joint replacement surgery 20 years ago, it's all conventional. Conventional. That means everything with hands and eyeballing. That means you see, you feel. That's how we do it 20 years ago.
No
And you see,
technology was involved.
no, not so much. The technology is in getting the instruments to do that surgery. But as we go on, and we go on, it's still we going on. The technology is always evolving. 10 years ago, we did what we call a patient-specific instrumentation. So how we do that? When I was in uh, in other hospital in Prince Court, so I had this uh, MRI of this patient, where I send this MRI scan to United States, and they will come back to me with some instruments that is specific to the patient. So when I open up, because I have measure the size, the alignment of the patient, so it's so easy to do the surgery. That means we open up and we just put the instruments and we get a perfect alignment from this. This is what we call patient-specific instrumentation.
Right.
Then comes the computer technology. So the computer technology is to help us, again, the same thing, the size, the alignment, and where to make the cuts, right? It helped us. It's a tool for us to have the surgery. And nowadays, we are talking about AI. We use robot.
Yeah.
It's a robotic surgery where it's not the robot doing the surgery. It's actually the actual name is robotic assisted total knee replacement surgery, whereby the robot, as we hold the hand of the robot to make all the cuts, but the robot is already, we help the robot plan the surgery. So it is very precise, and when it's very precise, it will make the implant last longer.
Right.
Number two, it also tells us the correct balancing, where your normal hand is very difficult. It's very experienced, yes, you can. So these are the reason why technology is very important. It helps us, especially the younger surgeons. The experienced surgeons, I don't need this, but it also helps them. Help me. Yes, robotic is the current thing now.
All right. All right. In terms of benefiting patients in the long run and all, any inputs on that?
For the robot,
The technologies in terms of how it benefits the patient.
yeah. So as I said, with technology, number one, it helps the surgeon to get precision. Number two, you feel you will have good balancing with the, as I said, robot help us to feel the balance of the surgery that we do. Balancing
Okay.
means that means we don't cut too much or we put implant that is not too big. So the robot will tell us to do this.
All right.
Of course, the senior, more experienced surgeons, well, will don't really need this, but it helps.
Okay.
Yes, in turn, when you have good precision, when you good balancing, you have good function, and the implant will last as long as it can be.
Okay.
Nowadays, the total knee replacement will last 15 to 20 years. With
Wow.
the help of robotic technology, maybe it lasted 5 years longer.
Last longer, yes. All right. All right. Okay. So, doctor, what is the typical recovery timeline for a total knee replacement, and what can patients do to optimize their rehabilitation period?
Wow. Okay. Of course, you must have good surgeons to
Yeah.
get good results. And the first thing I always tell the patient, if you do one surgery today, this morning, you do a total knee replacement surgery. Sometimes the patient can walk in the afternoon because
Okay.
if you have a good anesthetist, the pain usually will not be so bad that the patient can actually walk in the afternoon.
Okay.
But in most cases, you do the surgery today, the patient walks tomorrow, right? This patient will start physiotherapy tomorrow, the next day, and usually they can be discharged 2 days after surgery. And how are we going to determine when the patient can be discharged? When the patient are independent out of bed, independent going to the toilet, using walking cane, of course, walking stick or walking frame. So usually, how long the patient should use the walking frame? If the patient is strong enough, by 2 weeks, he or she can shift to walking stick,
All right.
right? So by 4 weeks, probably she can walk without any aid. I would say recovery, full recovery of the surgery, not from the total knee replacement surgery, from that surgery episode, is probably 6 weeks. This is
Okay.
when I will see the patient at 6 weeks. And usually at 6 weeks, the patient can bend almost full. In all, in all the literature I've read, the uh, the the full recovery of total knee replacement can be about 1 year.
Okay.
Yes. In fact, they have studied on what they call the forgotten knee. You know what
Forgotten
forgotten
knee.
knee?
No, doctor. Please
Yeah.
enlighten me.
Okay. The forgotten knee means the patient who have a knee replacement surgery forgot that they have a knee replacement surgery.
All right. It is that
So
seamless.
yes,
Uh-huh.
that would be a success for doctors.
Correct. Correct.
Of course, they're very good for the patients. So a forgotten knee usually probably about 2 years or 3 years,
Okay.
right? So full recovery in all aspect is about 1 year from the wound, from the internal wound, from the skin, it's about 6 weeks. So I would say, when can you jump to the swimming pool? 6 weeks,
Okay.
you know?
All
Yeah.
right.
When can you start playing golf after
Six
knee
weeks.
replacement surgery? I would say 3 months to six
Okay.
months.
Okay.
right? Yes. So this is a timeline. It's a
So it
very,
every activity has its own timeline, I
yes,
guess.
yes.
Yeah.
Of course, you can't play football.
Yes.
Yeah. I think after a knee replacement surgery, you can play um, almost all sports, but not contact sports. So that
Okay.
means you can play badminton, you can golf, you can play simple social basketball, tennis. Yes, yeah. I think the idea is there's no pain and you can enjoy the game.
Can pretty much go back to living their normal activities.
Yes, that the idea
Yeah.
of a joint replacement, especially a knee replacement surgery.
Right, right, doctor. But in terms of after a successful knee replacement, what are the significant improvements in quality of life that patients can typically experience, doctor?
Okay. I mean, I've seen so many patients that, a success story. Of course, there are
Mm.
some risks of,
Concerns.
stiffness or that.
Yeah.
But most cases, total knee replacement surgery has about 95 to 98% success story, right? I mean, it's successful. So
Okay.
this is in the literature, right? Okay. Uh, your question is on quality, right? What quality of life? So
Quality of life. Yeah.
yes.
Improvements on that
So
part.
I think it's what the patients do before that they cannot do. Okay, for instance, I give you an example. A patient who come to see me, he is a 87-year-old. After COVID, he went to Langkawi with his family, but he has very bad arthritis. But he wants to go because he has not been out, you know,
Okay.
and the Langkawi was just open up for
After
tourists.
COVID. Yes.
Yes, so he went with his family, but it is not really a wheelchair-friendly place in Langkawi. There is a place selling nasi dagang in the middle of paddy field. So
Okay.
that's
Yeah.
yeah. So you can't push your wheelchair there. So he has to stay in the car. So coming back from Langkawi, he straight came to see me and said, "I want a knee joint replacement." What is the
Okay.
reason for that? The reason is for that is reason for, I mean, so the reason is because he wants to enjoy his life with his family so that he can go out and, have fun. And if he has to stay in the car or he is hesitating to go in the first place, then there's no fun in that. There's no quality of life in that. Similarly, if you see sometimes you can see, uh, our elderly parents or even uncle. Um, if you want to go to a shopping mall, for instance, and they choose to stay at the nearest bench that they can see, and they will say, "You go ahead first. I will follow suit. If I don't follow suit, you come back and get me." Right. Why? Because they have a bad knees. If they have a good knees, they will go and maybe buy something and get something present from the family. So these are the thing. This is all quality. If you
Right.
sit on the bench, there's no quality. Might as well you sit at home and watch Netflix.
Yeah. Right. In terms of people who are generally very hesitant about the surgery, right, doctor, what are the top reasons you would suggest to consider a total knee replacement if conservative treatments aren't providing relief anymore?
Yeah. Okay. Okay. There's a
Well,
lot of reason.
what are the reasons you think people should consider for the surgery?
Yeah. That's a good question, but many times when the patient come to see me, they will have many reasons not to want to have surgery. because they want to explore conservative treatment,
Right.
right? What are the conservative treatments? Supplements,
Mm.
physiotherapies. They sometimes go to acupunctures, as long as it's not surgery. So I will say to the patient, if you have, gone through all this and gone through multiple injections and it's not improving and you are still in good health, and if your x-ray is stage 3, stage 4, I always tell them you can actually avoid all this injection, avoid all this going to the uh, masseurs, going to
Multiple times.
acupunctures, you know, and have a definitive treatment, which is a joint replacement surgery. Of course, it has to have proper indication.
Mm.
So yes, coming back to your questions, that is the most important reason where you have a definitive treatment
Yep.
once and for all with 95 to 98% success story.
Like a guaranteed success story
Yeah, I mean, this is in
we're
the
talking
literature,
about.
right?
Yeah.
Yeah. The thing is, the longer you wait, the result may be not as good as if you decide early.
Right.
Some patient who decide so long to wait to do a knee replacement surgery after being advised to, they will have fixed flexion contracture. That means they cannot straighten their knee. They cannot bend fully. And even though you are doing the surgery with robotic or very experienced surgeons, sometimes you cannot reverse this because it's too late. It's become permanent. And the idea of that surgery is just to reduce pain, but not to
Yeah.
get good function. So in order to get good function, in order to get painless knee, surgery need to be done or should be done as early as when it is indicated.
Right. Right.
Yes, don't wait. When
Right.
health is good, do it.
All right, okay. With that, thank you so much, Dr. Badrul, for those insightful explanation on replacement surgery. And it's truly inspiring as well to see how these advancements are helping people reclaim their mobility and being able to live without pain, I would say. All right. Anything you'd like to add, Dr. Badrul?
Yeah, let me see. Um, just look at total knee replacement as not a surgery per se. Just look at it as a treatment.
Yeah.
Like you take your medication for your hypertension, right? You take medication for your diabetes. So when when the doctor says your knee is ready for joint replacement surgery because of stage 4 osteoarthritis, because you have rest pain and you can't move, you cannot enjoy your life, total joint replacement will add life to your years.
All right.
Very much.
All right, thank you so much, Dr. Badru. All right, thank you so much for that. And now, ladies and gentlemen, we continue our journey into joint replacement. And I'm pleased to introduce our next speaker, Associate Professor Dato Ruslan Nazaruddin Simanjuntak, Consultant Orthopedic and Joint Replacement Surgeon. Hello, Doctor.
Yeah, hello. Yeah,
Hi, Doctor. How are you?
yeah. All right, good. Okay.
All right. All right. So to jump right into our session today, right, Doctor?
Yeah,
Uh, just a very curious question. What does your typical day looks like in terms of what actually inspired you to specialize in joint replacement surgery or hip replacement surgery?
actually, it was by chance. I think it's about 27 years ago or 28 years ago. I
Okay.
want to become a spine surgeon, and I do a lot of spine works. And then there is some during my traineeship in the hospital Kuala Lumpur. There is nobody do the joint replacement. Then my boss asked me to cover joint replacements, and from then on, that was 96. I never moved from that field. So I went for my fellowship in 97 with in US and worked as a joint replacement surgeon since then. Now it has been about 27 years as a joint replacement surgeons. Yeah.
So did you have any surgery today?
Yeah, I did. I
You
did.
did.
I did have yesterday, and then I did today, and then this afternoon. After this, I have another one. All right.
Wow.
And then the day after
Okay.
tomorrow, I have
So
another one.
this is how your typical day looks like, having surgery after
Yeah,
surgery.
out of Monday to Saturday, maybe 4 days on surgery. So it's quite hectic, it's quite tiring.
All right. All
Age.
right. All right, doctor. My first question for you,
Yeah,
doctor, is there a grading system to qualify patients for total hip replacement surgery?
yeah. It is actually. It is called
Mm-hmm.
arthritis. Yeah,
Mm-hmm.
it is the inflammation of the joints. And it has grade, it is called Tony's grading. It is 1, 2, 3, and 4.
Okay.
Yeah, so that means the 1 is basically is very mild.
Mm-hmm.
Yeah, it is you can sort of treat it with the conservative like physiotherapies and supplements, etc. And then 2 is more than that, and
Mm-hmm.
3 and 4 is usually is more severe.
Mm-hmm.
Usually patient which unable to having pains quite regularly, and then even some in 4 is even less pain. So that between 3 and 4, or 4 to be definite, is you need to have a joint
Yeah.
replacements for that. Yeah.
Mm-hmm. All
And then
right. Okay. Any more? Any
no,
more?
no, I think it's number 3 is really sometimes it depends on the activities.
Mm-hmm.
Yes, because sometimes when the patient is quite active, then they want to be active again, and that is where you need to have a surgery for that.
Okay. All
Yeah,
right. So that being the grading system to qualify patient and for the
yeah,
total hip
yeah.
replacement surgery. But in terms of the key differences between anterior and posterior approaches to
Yeah.
hip replacement surgery, could you share what are those, doctor?
All right, I think you know about anterior and posterior because this is quite new. Most okay, I did my hip replacements. First one is I think about 27 years ago, and
Okay.
we always do from posterior or the lateral. Lateral meaning on this from the side. At that time, we don't know anything about anterior in Malaysia. Yes,
Mm.
so we have most of my surgical techniques basically I went to from the side, which is it is called lateral. Yeah,
Mm.
so everything is like that, and then whatever grading 3 and 4 positions, whether we want to do any cementless or cemented system, then we use everything system we use from lateral. Yeah, so but the
Mm-hmm.
anterior is quite new to Malaysia,
Mm-hmm.
where I did my anterior approach since 10 years ago. Yeah, and then which I learned it from in Australia, one surgeon from Australia and France, and then since then I never looked back. And we have some indication for anterior, not everybody. And
Mm-hmm.
the difference between the anterior meaning front, posterior meaning back. Yeah.
Mm-hmm.
So the front one usually is cut advantage is because one, it does not cut the muscles.
Mm-hmm.
It doesn't cut the complication is quite less. The
Mm-hmm.
bleeding is less, and then the pain after the surgery is much
Okay.
less. So that means the patient able to walk again or really mobilize even within less than 24 hours after the
Okay.
surgery. So that's
Okay.
the idea.
Mm-hmm.
Actually, this one is can be either use the with cement or without cement. Yeah, for that. So the advantage is basically recovery period is faster. And
Mm-hmm.
then one of my patients, actually, I always ask them to send me pictures of them after 1, 2 months, and 3 months, and so on. And then he showed me he come from Penang. 1 month, he said I can walk. All right, good. The second one, he said he showed me how to do jogging.
Okay.
Okay, fine, quite good. And then the third month, he went to something like a hike, a hill hike, something like that, which is uneven surfaces.
Uh-huh.
And he's very happy with the
It's
outcome. And
it's a huge success for you, I
for
think.
that, yeah.
Yeah.
Yeah, he's very happy because he's able to active again, although he's 70 years old. Yeah,
Mm,
so he's happy to do his daily activity, doing the one that he wants to do. He likes to
yep.
jog, he likes to do activity, running, and so on.
All right, doctor. In terms of advancement
Yeah.
in this industry, right, doctor, what advancement have been made in hip implant materials, and how do these advancements have actually impact the patient's outcome?
Yeah, in terms of you said materials, meaning it's the content of the implants. Yeah,
Yeah.
so those days in the 60s, it is called cobalt chrome or something like a normal metal. Yeah, and then they become shiny, and then they become rough.
Mm-hmm.
Yeah, and then they can just coat it with some material which is called hydroxyapatite. Yeah, all these things is quite new, but the latest one is basically is made up from titanium.
Titanium.
Titanium, yeah, titanium is why it's chosen because they have more or less the same amount of quality of bones, the same
Mm-hmm.
as our bone, the
Mm-hmm.
softness, yeah, the stiffness, yeah, it is more or less the same. And then the other one is basically the we call it the metal, sorry, totally comprised of the ball and socket, yeah.
Mm-hmm.
Yes, so that means this one usually is made up from what do you call it, ceramic. I just show you one pictures. Maybe you can see this one.
A
The,
bit nearer
yeah,
to the
correct.
camera,
Yes,
doctor.
the ball. Yeah,
Okay.
the ball is made up of ceramic.
Okay.
I used to do it from just from the metal. So
Okay.
now I use it only for ceramic in the last more or less 10 years. Yeah, because the reason is being here. If the ceramic is less friction, that should
Mm-hmm.
last long.
Mm-hmm.
Yeah, in the literature, the longest hip replacement in the world is about 33 years old. But
Mm-hmm.
in my hand, in my personal hand, it's about 21 years old.
Mm.
And because I'm 27 years as joint replacement. But one of my patients, 21 years old, which came recently, he wants to do the knee. This is time. So when I inspected her, and my hips on both sides has been 21 years without any problems. So it's
Wow.
quite good outcome for that.
All right, definitely. All right. Thanks for sharing that, doctor. Doctor, in terms of the concept of a minimally invasive hip replacement, right? Could
Yeah,
you please share a little bit about that and what are the potential benefits of this minimally invasive hip replacement?
yeah, correct. The one that I mentioned just now, the anterior, it is called direct anterior approach.
Mm-hmm.
Meaning you went from in front. Yeah. So my wound usually is about 7 to 8 centimeters. I'm not sure how do you mention that seven
Okay.
centimeters. Usually it's about the finger of my
Mm-mm-mm.
index finger. Yeah. So that means it is small incisions, and then like I told you, meaning minimal invasive minus the cut of the muscles. I don't cut the muscles. I
Mm-hmm.
just grow in between the muscles,
Mm-hmm.
cut the capsules, and then put up the implant. Then you move after 24 hours or so. So the
Mm-hmm.
benefit is basically one is pain is less. Two, you can walk earlier than posterior.
Mm-hmm.
Yeah, and the chances once you have done it for many years, the complication is less. So
Mm.
for patient itself, usually should be able to get the benefit from the minimal invasive. But to do that, usually the surgeons have to be trained on how to do the minimal invasive. Like for me, 20 years ago, I did my minimal invasive slightly different than what it is now. Yeah, so I put two
Yeah.
incisions and then it doesn't work. Then I put posterior and I don't like it. And today, I did the minimal invasive from anterior, from front. I like it. And then I think this is quite norms for nowadays to get the anterior. Because like yesterday, I did one anterior approach that this patient come from overseas asking for anterior approach.
Okay.
So they said he knows already read because he's American. In US, about 60% of the surgeons in US already did anterior approach compared to
Okay.
posterior approach.
All
And
right.
it's quite a trend now, which is anterior with minimal invasive. Yeah.
Okay. All right, doctor, my final question for you. What are the most common complications associated with the hip replacement surgery? Any complication stories that you have, experienced or anything? And how can they be prevented or managed from your experience, please?
All right. So the most common one is usually infections. Yeah, but the chances is about 1%, 1.2%.
Okay.
And usually we treat you with some antibiotic coverage so that the chances is much less. But the common one that you always, which is not, doesn't want to see it, is dislocation. Yeah, dislocation. Because any ball socket, it can be dislocated. So sometimes it is worse. In my experience, I did some dislocation as well, but I need to put it back. And then how to prevent it is basically, one is you have to suture it back properly. Secondly, you have to put the materials that you put up in the hips in the correct position and correct alignments and correct tensions and balancing. Make sure that everything was perfect. Then we shouldn't have any complications. The other one is, we call it is deep vein thrombosis or blood clot. Yeah, it's quite common.
Yeah.
It's quite dangerous as well, because the blood clot can happen in the lower limbs or the legs, and then if it is dislodged, then it go to your lung and become mortality, meaning death. Yeah, which is, I think I always mention these three things in my patient, that possible complications. So what I did yesterday was, this patient have a blood clot earlier, 1 year ago.
Yeah.
On the other side, not on the opposite side. So, but to prevent it from blood clot to be transferred into the lungs, so we call it, we have to put a filter in the vein, the main vein. So we call it IVC filter, which is, I think, another procedures before surgery. If you don't have that and then dislodge, then I told him that you might die on table. And then he doesn't want. So doctor, you put up the filter first, and then only then. Yeah. So I will do that. But basically, us as surgeon, we try to make it safe as possible before we do the surgery. The complication, we know what is the complications, and it should last you about 20 years or so locally, as far as I know.
Yeah.
You should be able to last about 20 years without any issues for that.
I think to avoid the issues, best to take the advice from the surgeons as well, since they have the experience in the
Right. Yeah.
area, right?
So
All
because
right.
most my complication, I will not say that I'm a perfect surgeon. I've been working like this for 37 years. I have so many issues, which is done by me and by my friend, by my juniors, and by other colleagues, which we need to sort of rectify it immediately after that.
All right, all right. Okay, thank you so much, Dr.
But,
Ruslan, for sharing a lot of insights into total hip replacement surgery as well. All right, without further ado, I'd like to invite Dr. Badrul back to join Dr. Ruslan along to answer some questions from the audience. So we'll just jump into our Q&A session. And Dr. Badrul, please join us.
Yes, I'm back.
Okay. All right. So we'll just jump into the first question from the audience and directed for Dr. Badrul from Michelle. I heard that weight can affect how well knee replacement surgery works. Should I be worried about my weight before thinking about getting the surgery? Dr. Badrul?
Yeah, that's a good question. yes, and also no. You don't have to worry about knee replacement surgery. It's a vicious cycle, actually. Of course, the best way to do a total knee replacement surgery is less than what we call BMI, less than 40%, right? Um, but uh, for us who wants to, for patient who wants to do a joint to do weight reduction, they need to do exercise, right?
Yeah.
Sometimes when you have a bad knees, you cannot do anything. If you have bad, you have a worse if you have rest pain, you cannot do anything. So yes, you can do a knee replacement surgery, and then you can exercise and reduce your weight. Especially, don't forget about the diet. But nowadays we have bariatric surgery. Sometimes I will inform the patient, if you can't lose your weight, you can't do exercises, maybe you can try bariatric surgery and reduce your weight to a certain extent. And because your knee is already bad, you have to do it anyway, even though you are very thin, but you have a bad knees, you still have to do the surgery.
Yep.
So it's a vicious cycle.
Yep.
Yes, I think weight is very subjective. Even if you are 130 kilogram, if you need a knee replacement surgery, you need a knee replacement surgery. You can either do the exercise later before that, or you can do your bariatric surgery after your knee replacement surgery, or even before that. So I think, yes, weight is an issue. Why? Um, because all these weight-bearing joints will have impact. They will have wear and tear. The bigger you are, if it's not proportionate, it will cause more wear. But bear in mind, the wear and tear is actually not because of the weight of the patient, it's because the operation was not properly done. There's more stress on one side, or it's not the balance is not good, and this is where the knee replacement fail. Not really so
Right.
much on the weight.
So I think the answer is yes and no. I think
Yeah, that's why I said yes and no.
you have
Yeah,
given your
you have,
explanation.
yeah, you should have not so high weight. You meant the moment if you are 130 kilogram, for instance, right? So your aim is to reduce your weight. Okay, you can do your knee replacement surgery, but provided after that you exercise and reduce your weight. Because the more weight you are, the more weight wear and tear you will have. But as again I said, wear and tear is not really from the weight, it's from the stress of not properly done, or the balancing of the knee is not so good, and you will have earlier wear and tear.
All right, all right, all right. Thank you so much, Dr. Badrul. And we have another question for Dr. Ruslan from Sabrina. I don't like surgeries, but this sounds important. And how to prepare physically and mentally before having hip replacement surgery, Dr. Ruslan.
Okay, all right. This is quite interesting patients thing like that because I have one similar patient has been shopping around for pain and her hips, which is she needs a surgery, but she's hoping that to find somebody that said you are not don't need surgery. So at the end of the day, she shopped from one hospital to one hospital, and everybody's saying that you need surgery. There's sometimes one of the hospitals try to give injections, physiotherapy, and everything doesn't work. After 5 hospitals, within 3 years, then he come to me. So I don't know, maybe I'm lucky. Yeah, so but I talked to her. You see, you need to be prepared. Although you need to have surgery, that's for sure. I explained what is the problem with her, which usually is a tonus 4, a grade 4, which is already you need surgery. You can't walk. When she walks to me, it's usually walk with with a walking frame, yeah, and then it's very difficult to have walking like that. I tested her in this room, and then I talked to her about preparations, the benefits of the surgery, and then what you can do after surgery in front of her son. Yes, you can go for holiday with your families, everything, now you cannot go for holidays, everything. So that is something mentally I need to prepare herself mentally like that. And as for the physical preparation, basically, yes, after for 3 years, you can't walk, everything, your muscle tone, everything was down. Usually grade 5 normal to become grade 4, even grade 3. Yeah, which is I have one patient like that. So
Yeah.
yes, again, you have to do some pre-op assessments or exercise to strengthen up your muscle and prepare physically for your surgery. And usually the most important thing is mentally have to be prepared. You have to mention what is the pro and cons of the surgery. If you don't do this, what happened to you? When you do that, what happened to you? Because you don't want to. I always make examples like this. I'm sure you want to go for holiday with your family, like Dr. Bat mentioned just now. You go there, then suddenly you cannot move. You cannot move. You just stay in one place, and then the rest of your family is holidaying in the certain area, which I think is a very important subject for preparation prior to the hip replacement. Yeah,
All right.
yeah,
There's one final question for Dr. Ruslan.
yeah.
Hi, doctor. Any activities or exercises I should avoid after my hip replacement surgery?
Basically, if able to show you a video of my patients, yeah, the one that I said just now, after about 4 months, he can do a so-called jogging, mild jogging, not very active jogging, mild jogging. Some of my patients able to do play golf, move around without any problems. And then after about 1 year, and then she got pregnant after about 1 year after hip replacement, and then able to deliver like a normal. And I think this is something like the lifestyle the back to normal after about a year. So you can I, I wish I can show you the video of my patient that. But the most important thing that you cannot do after total hip replacement is something that you need to have impact on your hip joints. Yeah, especially when you want to jump. Yeah, and running
Yeah.
in long distance. Long short is okay, fine. But impact and animation is right. And make sure that there is certain movement that you can't do. Yeah, if it is, for example, is squatting. Yeah, full squat. When you have
Yeah.
over here in Malaysia, you have so-called toilet on the floor. That you can't do that before that, because it can become dislocated after that. Yeah, the chances of dislocation is a bit high. And then apart from that, usually try not to play anything if it is very young patients, let's say 40s or the 50s. Don't try to do any sports activity that very vigorous that have a contact game, and there is a possibility of injury. So try to avoid that for that. Yeah.
All right, all right. Thank you so much, Dr. Ruslan, for
Yeah.
sharing on that. And we have one final question. Probably Dr. Badrul and Dr. Ruslan, both of you can answer this question, and we can do a closing after that, just to summarize our discussion for today. All right. Question from Vivishan. Do I need to make any lifestyle changes before the surgery, and what is expected? What is the expected recovery time, and when can I resume normal activities?
Okay. Yeah. I mean, basically like I said before, changes before surgery. Yeah. Yes. Okay. Basically, the one that you need surgeries or hip replacement usually is you need the senior citizens, or more or less on the after 50s or 60s, even senior than that. You know. So, no doubt, when you have pain on your hip, usually you should change your lifestyle. Yeah, so you can't really do activities as normal. So first, the preparation for the surgery is basically you need to have a light exercise or mild exercise to avoid any muscle wasting. So this is the must. That you can carry on with your activities normal, domestic and around your house, no problem, but not so heavy headache, and then try to avoid fall. And the recovery time after surgery usually I would say maybe it's about 3 months to 6 months for hip replacement. Yeah, the one that I showed you just now, that patient able to do jogging after about 4 months. Yeah, so should be okay. And then normally lifestyle back to normal is usually is about 9 to 12 months. Back to
Okay.
normal. Yeah.
All right.
Most of the time. Most of your daily activities. Yeah.
Okay. Dr. Badrul, anything else you'd like to add on?
Yeah, I think the idea of the knee, any joint replacement surgery, whether the hip or the knee, is to get back to normal routine activities. Of course, it is minus the impact activities, right? I mean, with exception of Andy Murray. You know who Andy Murray is? Andy Murray is a tennis player, former, I think he has been number one. I think he has a hip replacement surgery and he still plays. And, that is exception because he knows that one day he will have revisions. So the idea of recovery is to go back to your normal activities. Must remember, whoever wants to have this surgery, it have a lifespan. The more impact activity, it will reduce the lifespan. So yes, you can go back to your normal activity, but minus the impact activities. That means no football, no, jumping. The rest, I think, shouldn't be a problem. Yes. In order to prepare for this, of course, read first, talk to people, see doctors,
Yeah.
then decide, and don't be ambivalent, right? Don't procrastinate. That's what people say. Yeah, it's a good surgery, and a good success story.
All
That's
right.
yeah.
Okay, doctor. Thank you so much for sharing, and thank you, Dr. Ruslan and Dr. Badrul
Okay.
as well for answering the Q&A questions. And with that, ladies and gentlemen, thank you so much for joining us on Steps on Mobility Hip and Knee Replacement Explained. And we hope you found today's discussion both informative and inspiring. Special thanks to our expert speakers, Dato Dr. Badrul and Dr. G. Ruslan, for sharing their invaluable knowledge and insights into knee and hip replacement surgeries. Thank you so much, Doctor. Thank you
Okay.
so
Thank
much,
you.
Dr. Badrul and Dr. Ruslan.
Yeah.
Understanding this procedures definitely can truly empower someone, to make informed decision, like you mentioned, about our health and mobility. So whether you are considering this option for yourself or supporting someone who is in need of this, we hope you now have a clearer picture of how this advancement can lead to a more active and pain-free life. All right, RT Orthopedic Hospital is here to support you at every step of the way. So if you have any questions or need additional information, please do not hesitate to reach out. All right, so book an appointment with them, and it is very easy and simple to get in touch with them. The details are in the comment section. You can send a WhatsApp message or call them, get to know the comprehensive resources and to learn more about their services. You can also reach out to www.altortho.com. All right, the details are in the comment section. If you need more information, comment as well. We'll let you know. All right, once again, ladies and gentlemen, thank you so much for being a part of today's session, and we wish you all the best on your journey to better mobility. All right, I guess that's the
Yeah.
wrap for today's session. All right, with that, from three of us here, have a wonderful evening, everybody. Thank you so much.
Thank you.
Thank
Bye.
you.